Thank you for staying with us. Now to health matters. Doctors in Kenya state-run hospitals have rejected a government offer aimed at ending a 3-week-long strike. The Kenya Medical Practitioners, Pharmacists and Dentists unions, which represent over 7,000 members, went on strike on March 15th to demand payment of their salary arrears and the immediate hiring of trainee doctors. The story was the same in Nigeria's southwest, where resident doctors at the University of Medical Sciences Teaching Hospital, UNIMEDTH, in Ondo State, have commenced a 14-day warning strike. The doctors, under the auspices of the National Association of Resident Doctors, NARD, cited, among other reasons for embarking on the strike, the non-payment of 7-month salaries to their new members. And to further discuss this, I'm joined by a medical officer intern from Kenya, Dr. Micheni Mike. Hello, Dr. Micheni. Thank you so much for joining me.
Thank you for having me.
It's a pleasure to have you. All right, so let's start with this, okay? Now, as a doctor, right, in Kenya who is directly affected by this, what are your insights into the ongoing strike by the Kenya Medical Practitioners, Pharmacists and Dentists Union? Can you elaborate on the specific grievances and demands of the striking doctors?
Yeah, absolutely. So initially, as we started, when the strike started, the main thing that the union was asking for through the doctors was for the immediate posting of medical officer interns. There was a delay, and that's where it started. But as time went by, it became a matter of the delays now changed and became something to do with the pay of the interns. So there was a 91% slash of the medical officer intern's salary, the remuneration. There was total removal of allowances, including the risk allowance and the call allowance. And these were removed, and so this drastically changed the ball game. And so even eventually when the strike was called, it was now a matter of uh, the entire infrastructure of healthcare now being affected. So the demands are currently, as we speak, the demands are for the immediate posting of the medical officer interns as per the demands, as per the agreement that was signed a few years back, with the correct payment of their basic salary and their allowances. Alongside that, there's also been a lot of talk with the government regarding the universal healthcare coverage, the UHC. So we're also demanding for employment of the health workforce, the doctors. You need doctors for their UHC to come to life. So employment of more doctors and also allowances of the medical officer interns.
All right.
So this is just some of the few, yeah.
All right. But then how do you believe the strike is impacting healthcare services and patient care in state-run hospitals across Kenya?
Yeah, it's very sad because we have the total shutdown of public healthcare facilities, and public healthcare are the ones that see tons and scores of patients, and so the the medical the healthcare is really on its knees and it's crippling, and so this needs to be sorted out with immediate effect because the patients are suffering the most. If you have a facility where you don't have doctors, sure, there are things that nurses can do. There are things that the clinical officers or what they're called physician assistants elsewhere. There are things that they can do, and there's a way that they can bridge. But even now, it's gotten to a place where it's worse because we not only have the medical officers and the doctors on strike, we also have nurses who are threatening to join the strike alongside lab technicians and even the clinical officers. And so the healthcare is really on its knees, and it needs an urgent CPR.
All right. So, but then, after all said and done, you guys, that's the Kenyan doctors have actually, let out their grievances. And I'm very sure that the government is actually listening right now. What steps do you think should be taken to, address the underlying issues and also facilitate a resolution to the ongoing labor dispute?
Yeah, I hope the government is listening, and I'm sure they're listening. So we need immediate posting of the medical officer interns as per the agreement that has been in place from 2017. We need the government to place aside all the PR antics, all their stunts, and all the photo taking and we need them to get on the bargaining table. It's a terrible situation for doctors to be on strike. This is not what we signed up for when we took our Hippocratic oath. All that we know how to do is save lives. All these matters of going for protests and ducking as tear gas is launched at us, this is not what we signed up for. And so we need the government to come to the discussion table, pride aside, arrogance aside, and discuss how we can move on from here. We need the government to make moves and to make plans for the employment of more doctors. We need them. We also saw them recently. I'm sure you're aware that there was a shooting of the union leader, and so we are also demanding an immediate disciplinary action upon the police person, the policeman who shot the Secretary General of the union. And so we are also demanding that the facilities, all that we want actually basically, among all this, that is, once all this is said and done, all that we want is the collective bargaining agreement that was signed between the union and the government in 2017, for it to be honored and to be seen to its very end, every single part of it.
All right, Dr. Mike, would actually be coming back to you, but would love to introduce, the Secretary of the Association of Resident Doctors, that's UNIMEDTH, Olagbe Kehinde Timothy, who is also joining me on the news to speak on the strike in Ondo State. Hello, good evening, sir. Thank you so much for joining me, Doctor.
Good evening.
All right, so now as the Secretary of the National Association of Resident Doctors in UNIMEDTH, could you provide an overview of the current situation regarding the strike at the University of Medical Sciences Teaching Hospital in Ondo State?
All right, thank you, my presenter. Currently, we are on 14 days warning strike. But since the commencement of the strike, today is the second day to the strike, and the management and the government are beginning to show goodwill. Our members have started receiving alerts for the payment of their salary arrears and other benefits. However, some of our members are yet to receive the alert their own salary. So once that is done, we are sure that everybody has gotten paid. So we will convey an emergency meeting in a view to review and suspend the strike. So that is the current situation now.
All right. So now, talking about an emergency meeting to review and suspend the strike. Can you tell us the main reasons behind the decision to commence on the warning strike, particularly regarding the non-payment of salaries to new members?
Yeah, it's quite pathetic that a doctor could be denied of basic things such like the salary. We have some of our members who join the employment of the teaching hospital being held up to an arrears of 6 months, some 5 months, and some 4 months. It's actually pathetic in the sense that the situation we are in Nigeria is critical, whereby we have a lot of doctors migrating, seeking for greener pasture in a foreign land, so which has made the health sector in their need of medical personnel. So it is very, very disheartening that in this kind of situation that doctors could be denied or could be hold salary. So that's it.
All right, Dr. Olagbe, you actually talked about, how it is impacting the healthcare services and also patient care at the teaching hospital and beyond. But then what efforts have been made to engage with healthcare authorities and also address the grievances of resident doctors prior to the strike?
Yeah, we have tried to meet with relevant authorities, both within the institution and outside the institution, to actually provide a lasting solution to the issue of owing doctors. And so we are trying to engage, apart from the issue of salary, there are other burnout issues that are confronting the healthcare delivery services of the hospital. So we are trying to meet with various government organizations that are involved directly involved in the health sector of this state. So we are making consultation. So and we hope and believe that the government will listen to our compassionate appeal to actually provide a lasting solution to hydra-headed problem confronting the teaching hospital.
All right, well, let's go back to Dr. Micheni Mike in Kenya, who would be wrapping up with, before we come back to you, Dr. Olagbe. Just before we say bye-bye, Dr. Micheni, if you can hear me, would love to have your last thoughts, especially on how the government and healthcare, you already spoke about the government, but what about healthcare authorities? You know, how can they better support residents, that's doctors, to address the systemic challenge facing the healthcare sector right now?
The collective bargaining agreement is our constitution. It is our Bible as the doctors. And so we must abide by it. And so all that we ask from not only the government, but even the other institutions is for their continued support. We know that with enough pressure, eventually the government will budge and they will listen, sit down at the bargaining table, at the negotiating table, and give a way forward, which is the right way. So we must abide by the law of the land. There have been reports of intimidation, but we will stand firm because indeed our union and our unity is what makes us strong. And eventually, this strike is not for the doctors alone. This strike is for the patients who will be seen by that doctor. You don't want to see a doctor who's been working a 96-hour shift. Some facilities only having 2 medical officers, and so they're working whole weeks long, non-stop. That doctor is not going to give you the best care. And so what we're sticking by is that the law must be followed, and we will stand firm.
All right.
Thank you.
Well, thank you so much for joining me on the news and sharing your thoughts on the strike in Kenya and also in Ondo State. Dr. Micheni Mike from Kenya, and also Dr. Olagbe Kehinde Timothy, all the way from Ondo State. Thank you so much for joining me.